Hi everyone, welcome to my channel Capsa. Today we will understand about Parkinson's disease. It's a very important neurodegenerative disorder. So look at the definition first. A disorder of central nervous system which consists of actually two parts, spinal cord and brain, that affects the small part of the brain and often including shaking, stiffness, difficulty with balance and coordination. This is the definition. It's a neurodegenerative disorder when nerve cells or neuron gets damaged, which affects the dopaminergic neurotransmission. Means dopamine producing neurons are mainly affected or neuronal transmission gets affected. English physician James Parkinson first described PD or Parkinson disease in 1817 and in his essay on shaking palsy. Okay. Later, Jean Martin Charcot named it as Parkinson's disease based on the honorary of that physician, English physician. Now, the small part of the brain affected. So, what kind of part of the brain affected? That is substantia nigra pars compacta. So, what does it mean? Substantia denotes substance or tissues here. Nigra is a Latin word meaning black color. Okay. So substantia nigra actually meaning is a band of dark tissue in the midbrain that contains dopamine producing nerve cells. Now why the color is dark or nigra? Because it contains neuromelanin kind of pigment which makes them dark. Now what does it mean pars? Pars meaning part. Compacta meaning compact bone. But here compacta denotes the part of an extensive midbrain. That is compacta. Okay. Now we will see what is the substantia nigra part looks like. So this is the normal mid part of the midbrain which contains substantia nigra in normal, and after damaging of some cells, obviously the area will decrease. So in Parkinson's disease, the substantia nigra cells after damaging looks like this. And here is the mid cutting section of midbrain. You can see the concentration of the substantia nigra cells decreases here. Okay. Now we will understand what is the cause. So I have told that it is due to the damage of dopamine producing neurons. So we have two neurotransmitters. First one is dopamine, which is also act as hormone plus neurotransmitter. Second one is acetylcholine, which is act as neurotransmitter. This two kind of neurotransmitter is available in normal condition. The activity of dopamine and or the concentration of dopamine and the concentration of acetylcholine is equal or equivalent. In case of PD, when Parkinson disease occur in PD, what happens? When there is a damage in the cells of substantia nigra pars compacta, or if there is a decrease in the number of cells of substantia nigra pars compacta, it causes decrease in dopamine concentration. As a result, it causes increase in acetylcholine concentration. Okay. So it is the main cause. So the main aim of PD drugs or the Parkinson disease drugs should be one, either enhance the dopamine activity, because the dopamine concentration decreases, or second one, to reduce cholinergic activity. So which kind of drugs we should use to enhance the dopamine activity? Obviously use prodrug, that is levodopa, okay, because dopamine does not able to cross the blood brain barrier. And to reduce the cholinergic activity, obviously use anticholinergics. Clear? So this is the main cause of Parkinson disease. Now we will look at the sign and symptoms. First sign and symptoms is tremor. Tremor means intentional shaking or trembling movements in one or more part of the body. Second one is bradykinesia, means slow movement due to the impairment of voluntary motor controls, which results in slow movement. Third one is rigidity. It also known as cogwheel rigidity. Cogwheel rigidity. Okay, it means stiffness of the arms or legs. And the fourth one is postural instability, means difficulty in balancing. Fifth one is dementia, means loss of memory. And the sixth one is depression, anxiety. Seventh part is apathy and abulia. Now, what is apathy? Apathy means lack of emotion, and abulia actually stands for lack of willpower. It means inability to act something. Others are sleep disorders, olfactory dysfunction. Olfactory dysfunction is nothing, just reduces in the sense of smell. And dermatological findings are oily, flaky skin you can observe, especially on the face and scalp part. And there are also other signs and symptoms like excessive daytime sleepiness, autonomic dysfunction, fatigue, pain and sensory disturbances, like this. Okay, mind it, TBR, or tremor, bradykinesia, cogwheel rigidity or rigidity is the hallmark sign of PD. Never forget, okay? Now we will see the sign and symptoms. So this is the tremor, okay, or shaking or trembling movement of the hand. This is a posture which represents the bradykinesia. Bradykinesia means slowed movement. Okay, so this kind of posture the patient will maintain and show a slowed movement. This is represents the rigidity or cogwheel rigidity. Cogwheel rigidity. It means when the patient is asked to rotate his or her hand, if he or she fails to do so, it considered as cogwheel rigidity. I have told that when patient is asked to rotate his or her hand, if he or she fails to do so, it is considered as cogwheel rigidity. Clear? Now, what are the diagnoses? So, based on the three type of findings, diagnosis is occurred. First one is neurological examinations like tremor, bradykinesia, rigidity, this kind of. Second one is response to various dopamine therapies, means levodopa, using levodopa. Third one is medical history, physical exams, etc. There is no specific laboratory diagnostic tests are available, but only besides that, MRI of the brain, dopamine transporter scan, these kind of tests are performed. Now, what are the treatments? First one is, actually there is currently no cure, but treatments are available to help and relieve the symptoms and maintain the quality of life. So the first is medicine. Anticholinergics, dopamine agonist, MAO-B inhibitors, monoamine oxidase B, type A, type B inhibitor, catechol O-methyl transferase inhibitor. This kind of medicines are used. If you need the examples, I will provide later. Second one is physical exercise like yoga, running, walking, this kind of, okay. So this is the complete lecture of Parkinson disease. If you liked the video, please do like, comment, share and subscribe. Thank you.